Hello, my name is Theo, and that's short for Sir Theophilus von Dog. Daddy says I will never get COVID-19, and that's because, well, I've got a secret. Wanna know my secret? Sit. The other hand. Here you go. Yum, 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 yum. Hi guys, I'm Dr. Jickee, and I've decided to make another video about COVID-19. For today's topic, it's going to be a little bit controversial, right? So basically, I've had a number of patients, friends who messaged me asking, do you have ivermectin in your clinic? And immediately, when I get that message, I know what they're thinking about, right? They're probably thinking of getting ivermectin to treat themselves, probably to cure themselves of COVID. If you've not heard, there's this thing going around claiming that ivermectin, which is an anti-parasitic drug used to treat scabies, heartworm, even for dogs, which I just showed just now, that it cures COVID-19 and no one will die once they've had ivermectin, which is actually a bit overblown. There is some evidence that suggests it may be helpful, but what's going around the internet, especially the dark web of WhatsApp and Facebook of the Uncle Auntie network, is that this is a miracle drug. All right, this is the word that they're using, Asian miracle wonder drug. All right, so I'm going to break it down to you what ivermectin really is and what are the studies that make this claim. Yeah, well, the other thing I wanted to do is to, well, sort of a public service announcement that you can stop trying to call every clinic asking if they've got ivermectin, because, well, in Malaysia, ivermectin is not typically used in humans, but if you want to, it's in your dog's medication. So like for my dog Theo, he takes HeartGuard, which is ivermectin actually, 136 micrograms per tablet, which he takes one tablet every month to prevent heart parasites in dogs, right? It's a pretty common anti-parasitic drug in animals. So if you've got friends who will own a farm, or you have farmer friends, they might feed ivermectin to your cows and pigs and other farm animals. There are many news reports that were centered around an in vitro study that never progressed to clinical trials. Basically, there is this study that was done back in June of 2020. It's the FDA-approved drug ivermectin inhibits the replication of SARS-CoV-2 in vitro. So what this study claims is that when they perform an in vitro study, now the key word here is in vitro. So what is in vitro? It's actually of a Latin origin. The word means in glass, something like within a test tube or a beaker. Basically, it means that the experiment was performed outside the human body. When applied to the virus SARS-CoV-2, all right, ivermectin actually inhibits viral activity. That is good, I guess, all right? But how significant is this, all right? So based on this one study, some people are going around claiming that ivermectin is the miracle wonder drug that's going to save the world from COVID-19. Well, how true is that? Well, just to put into perspective, let's talk about other agents that are able to do the same thing, right? Well, one agent that is very effective in killing viruses in vitro, outside the human body, is bleach. It can be used effectively to clean surfaces and kill viruses in the process. But would you then drink bleach? I mean, one has to be really out of his mind to advocate drinking bleach to cure COVID-19, right? I mean, no one in their right mind would suggest that. Yeah, another example is that hand soap and water inactivates HIV, but you can't drink soap and water to kill HIV and cure yourself of AIDS, right? Why is that? Because, okay, when a virus enters your body, like take SARS-CoV-2, right, it binds to the ACE2 receptor on the surface of the cell. It gets, there's this process called cell-mediated endocytosis, and it enters into the cell, right, in your lungs, in your nostrils, and well, if you take ivermectin, it goes into your stomach, into your gut, and it might not actually come in contact directly with the virus. So some effect through a cascade may cause some changes, but there is the effects you find from a human study and an in vitro study, they're not the same at all. So that's what happens. I'm not saying that is a bad study to begin with, right? So if ivermectin has good antiviral activity outside the human body, it doesn't mean that the study was completely worthless, because that brings our attention to that drug. And what we should do next is to perform human studies. So have there been human studies performed? Yes, right? I think I read this off MIM's article that there is at the moment about 30 plus studies, clinical trials trying to study the efficacy of ivermectin in the treatment of COVID-19 as well as prophylaxis. But the issue is that most of them are either retrospective or observational studies, which isn't the strongest evidence when it comes to clinical studies, right? The gold standard would be a placebo, double-blinded, randomized controlled trial. There are some, all right, and I was searching through the internet and all the database. I've come across 2 so far, and I guess we'll go into that right now. All right, so for the first study, this is from the Lancet journal, eClinical Medicine. It's a study that was performed in January of 2021. Right, the title reads, the effect of early treatment with ivermectin on viral load, symptoms, and humoral response in patients with non-severe COVID-19, a pilot, double-blind, placebo-controlled, randomized clinical trial. Right, so yes, this is a placebo-controlled randomized trial, which was published in January of 2021. It involved 24 non-severe COVID-19 patients, where after 7 days of treatment with ivermectin 400 micrograms per kg, showed no difference in reduction of PCR positivity among patients that were treated versus patients that were not treated with ivermectin. So they concluded that larger trials may be needed to better understand the effects of ivermectin. Right, so basically it was inconclusive. The second trial we're going to look at is the effect of ivermectin on time to resolution of symptoms among adults with mild COVID-19. This one was performed in March this year, 2021. And this was published under the Journal of American Medical Association, or JAMA, which was actually a randomized controlled trial involving 476 adults with mild COVID-19 disease. They were given 5-day course of ivermectin at a dosage of 300 micrograms per kg. The results showed no significant improvement in COVID-19 symptoms in terms of resolution time. So what they found was that the median time to resolution of symptoms is 10 days for the ivermectin group versus 12 days for the non-ivermectin group. So The difference of between 10 to 12 days is not really significant, and not much else really. So what we see is that, okay, they're quite small in number. One only had about 24 patients, and the other one had about 476 patients, and both of them showed no significant improvement. Now, I know I said we should only be looking at randomized controlled trials, but we're gonna discuss this one other study. So there's this one that's on the researchsquare.com, all right, with the title Prophylactic Role of Ivermectin in SARS-CoV-2 Infection Among Healthcare Workers. Now, it's actually a prospective cohort study conducted by AIIMS. AIMS stands for All India Institute of Medicine Science. So what they did is they gave 2 doses of oral ivermectin, again at a dose of 300 micrograms per kg, and at a gap of 72 hours. So the first dose, and then 72 hours later, second dose. These are given to healthcare workers, and then they were followed up for a month. All right, so those who eventually developed symptoms were tested for COVID-19, and the results showed that of 3,532 who were studied, 67% of them, which is 2,384 of them, took the ivermectin treatment, and 1,147 of them, which is 32.5% of this study population, did not take it. Yeah, so after following them for about a month, they find that 201 of them out of this 3,500 plus tested positive for COVID-19. And of this, 2% of the ivermectin group tested positive, whereas 11.7% of the non-ivermectin group tested positive. So they concluded that with ivermectin as prophylaxis, meaning taken before you're exposed, actually reduces the risk of COVID-19 by 83%. Pretty significant as well. But if you were to make a breakdown, number one, like I mentioned, there's selection bias because it's on a voluntary opt-in. They made ivermectin free of charge for those who want to take it. About 67% of their faculty choose to take it, and about 32.5% chose not to take it. Why did they not take it? Were they unhealthy? Did they have multiple comorbids that maybe shaped their behavior, or were they from a different social class and education level? I don't know. Then those things can affect the likelihood of you getting COVID in the first place, right? If you look at the discussion here, so healthcare workers who took ivermectin may somehow differ from the healthcare workers who did not prefer to take prophylaxis in their behavior, and we don't know how that may affect the likelihood of getting infected, right? Well, on top of that, another major limitation is that they only tested healthcare workers who developed symptoms, had direct high-risk contact with patients, right? And this was probably in keeping with the criteria for testing in India at that time, because testing isn't cheap. It's not a clinical trial where you had half of your study population on the treatment and half on the placebo, and then you test all of them after 1 month or something. Well, this was, you get to choose to be on ivermectin, so some people choose to do it and some opt not to. There could be a small number, all right, or even a big number who were asymptomatic and could have been positive on either side of on either groups, and that could really change the result. So is this a strong study? Not really. It's not placebo, double-blinded, randomized controlled trial, but it's significant enough that this should get our attention, like it got mine. And I'm of the opinion that yes, maybe we should perform a randomized controlled trial in this manner. They were testing ivermectin as a prophylaxis, means taken to prevent, and that is something we should probably look into. But it has to be done in a clinical trial because there are a lot of confounding factors that could affect the results either way. I think the biggest one for me was the fact that they didn't test everyone, and there could be a lot of asymptomatic infections in the ivermectin group. Some people might argue that taking ivermectin is like an additional layer of protection, very much in the same way as how wearing masks and washing hands or social distance is an additional layer of protection. But they are not the same because those other measures do not, under normal circumstances, pose any additional health risks, right? I mean, washing hands doesn't pose any additional health risks, but ivermectin is a drug, and like most drugs, there will be side effects. So let's see if I can do this. Possible side effects may include significant vasomotor reaction, edema, pruritus, urticaria rash, lymphadenitis, arthralgia, synovitis, fever, sore throat, cough, headache, tachycardia, orthostatic hypotension, edema, nervous system, dizziness, asthenia, fatigue, somnolence, vertigo, tremor, GI,
diarrhea, abdominal nausea, anorexia, constipation, vomiting, hepatic, increased serum, ALT, AST, liver enzymes, hematological, eosinophilia, decreased white blood cell, increased hemoglobin, ophthalmologic, conjunctivitis, ocular hyperemia, irritation, topical, limbitis, punctate, opacity, abnormal sensation, eyelid edema, anterior uveitis, conjunctival hemorrhage, oral, dermatologic, burning sensation, irritation, itch, dry skin, contact dermatitis, erythema, and potentially fatal, rally, and cephalopathy.
Now, of course, it would be irresponsible for me to imply that everything I just read will definitely happen to you the moment you take ivermectin. That's not true, but it comes down to the dosage of the medicine, right? If you were to down like an entire bottle of paracetamol, you might still get drug-induced hepatitis. Now, just for perspective, right? So my dog takes hard gut, okay, and this is for the medium-sized dog. One of these contains 136 microgram of ivermectin, and I feed him one tablet a month, right? Now, most of these studies, they were using a dosage of upwards of 300 micrograms per kg per day. So in an adult of about 70 kilograms, that's 21,000 micrograms, which is about 21 milligrams per day, which is 154 tablets a day of this, right? Would that have an increased likelihood of side effects compared to what could possibly happen to my dog? Yeah, I'll probably go with yes, most likely. I wanted to point out the misinformation that ivermectin is some kind of miracle wonder drug that can cure COVID. It doesn't, right? At best, most of the studies show some benefit, mostly insignificant. And the one with the biggest claim, again, there are a lot of confounding factors there. There's a lot of biases because it's a observational study, right? So I hope they do a clinical trial on that one. The verdict is not out yet. There are also a lot of other studies that are not yet completed. So I might change my mind as more evidence come out. But with the evidence we have right now, I would lean in the direction of not taking ivermectin because it's not beneficial enough to outweigh the possible risks you might get from taking ivermectin at such a high dose, right? Conspiracy theory that doctors and big pharma don't want to acknowledge that cheap, generic, and readily available drugs can help with COVID just isn't true. I mean, for example, we celebrated dexamethasone, right? It was approved for treatment, and this is a generic drug, doesn't cost much, and it's now approved to be used in treatment against COVID-19. Well, that's because they did a randomized controlled trial that involved 3,000 or more people, and it showed good evidence that it's actually helpful in actually reducing morbidity of patients, right? Healthcare and science has turned into this partisan parties anal thing, right? Where if people who believe in ivermectin don't want to get vaccinated. And then, of course, those who are on the yay signs pro-vaccine crowd will not entertain any evidence that ivermectin could be helpful, right? Let's try to take the middle ground, be out middle in our scientific approach, right? Let's look at the evidence and examine them and see, would it be good? Would it be helpful? I mean, if you want to take ivermectin, you should also get vaccinated. The evidence isn't overwhelming for ivermectin. It could possibly be beneficial, but there is overwhelming evidence that vaccines work, right, in preventing serious illness, hospitalization, and death. So I wouldn't recommend taking ivermectin, but if you want to take ivermectin, there's no reason why you shouldn't take the vaccine, right? Don't fear the needle.
Come on, people, don't fear the needle. Just take the jab. Don't fear the needle. To be able to fly, don't fear the needle. Science is on your side.